HIV stands for Human Immunodeficiency Virus, and if left untreated, it can lead to AIDS, acquired immunodeficiency syndrome. HIV attacks the body's immune system, leading to opportunistic infections, otherwise known as the last stage of HIV, AIDS. HIV originated in the Democratic Republic of Congo. Prior to the 1980s, they didn't know how many people had HIV. By the end of the 1980s, HIV reached 145 countries and 142,000 people through injections in heterosexual and homosexual sex. In 1999, AIDS was the fourth biggest cause of death worldwide and the number one killer in Africa. An estimated 33 million people were living with HIV and 14 million had died from AIDS. In 2017, for the first time ever, more than half the global population living with HIV are receiving treatment.
From this chart on HIV diagnosis, we can actually see that the Black demographic had the highest rate of diagnosis compared to any other demographic in the United States. And this is interesting to see how race may play a role in the number of infected people we see each year. The best way of preventing HIV is to have protected sex with a condom and to also be on some form of prevention like PrEP. You should also be checked regularly for STIs, and now we have a lot of drugs that can help someone who's already infected with HIV to live a long, healthy life. HIV is mainly spread through three ways: having unprotected sex with someone who's HIV positive, sharing needles with an infected person, or being born to an infected mother. So you can see that it's mainly transmitted through the mixing of bodily fluids like blood, semen, and vaginal fluids.
HIV is not commonly spread from kissing unless someone has an open lesion in their mouth. You can get HIV through oral sex if someone has open sores or cuts in their mouth. HIV is not a death sentence. HIV is not spread through contact with saliva, tears, or sweat of an infected person. 1 in 7 people that are living with HIV are unaware that they have it. This is a global health problem. HIV today is still a pandemic which has claimed more than 35 million lives so far, along with 37.8 million people living with disease right now. Between 2000 and 2017, new HIV infections fell by 36%, and HIV-related deaths fell by 38%, with 11.4 million lives saved due to the ART in the same period. There's no cure for HIV, though if effective antiretroviral drugs are used, it will help control and prevent transmission so that people with HIV can enjoy a healthy life.
From 2000 to 2012, there was a steady increase in the number of people living with HIV in terms of the global population. In the U.S., the number of people living with HIV increased each year between 2007 and 2012. The epidemics of HIV are mostly affecting low and middle income countries, and some factors that also play a role is someone's access to medical treatment, resources, and sexual abuse. The CDC has recently reported that HIV rates are higher than ever in the United States. In fact, about every 9.5 minutes a new case of HIV is diagnosed. In the U.S., Baltimore, Miami, New Orleans, New York, San Francisco, and Washington, D.C. are the most problematic areas. The UNAIDS Fast Track Plan was implemented in order to combat the issue of HIV around the globe. The first goal is the 90-90-90 target. So by 2020, 90% of people with HIV will know they're infected. 90% of those who will know will have access to treatment, and 90% of the treatment will be successfully suppressing the levels of the virus in the system. Also, by 2020, the UN hopes to see 500,000 or fewer new infections among adults.